After painkillers, antibiotics are the second most widely used drugs, many of which can be obtained from pharmacies without a prescription. This has led many people to take antibiotics at the first sign of a cold or difficulty urinating, such as candy. The high cost of treatment has also multiplied the prevalence of arbitrary use of antibiotics. Unaware that improper use of these drugs can endanger the lives of the individual and even those around him, especially if the patient does not complete the course of antibiotics. High intake does not mean the amount of antibiotics. The main problem is the irrational use of antibiotics, that is, it is used in situations where it is not necessary to use them. Antibiotics are mainly used to fight microbial disease. The word antibiotic itself is derived from the same word, that is antimicrobial, which are mainly bacteria. For example, most colds are viral, and antibiotics, which are widely used, have no effect on the course of viral illnesses. Subscribe our YouTube channel to watch the rest of this video and more. Of course, there is a limited range of antiviral drugs, but it is generally believed that antibiotics should be taken when a cold occurs. In this case, we say that the use of antibiotics is wrong. There is a more important problem, and that is that usually the patient is not careful enough to take the full dose of antibiotics long enough. This means that if he is going to take the medicine for a period of 7 to 14 days, he will stop taking antibiotics for the first 2 or 3 days when his symptoms subside. Relief of symptoms is mainly seen in viral colds. The disease resolves on its own. In any case, whether it is used inappropriately, if antibiotics are used sparingly and insufficiently, it will prevent the microorganism from being killed and become resistant. In such cases, it is no longer possible to easily kill this microorganism by taking antibiotics, because it will resist the antibiotic attack. The next time this microorganism causes a disease in a person or even other people, it becomes resistant and that antibiotic will not work properly. This is our main concern about antibiotics, and the fact that the World Health Organization names 1 year as the year to deal with the misuse of them is because of the importance of the issue of antimicrobial resistance. This is not only affect the person but also those around them, meaning that when a germ becomes resistant, if it is transmitted to other person, the previous antibiotic cannot be used on that person. In fact, the problem becomes acute when the disease is not outpatient. The patient is hospitalized for any reason. Most patients who are hospitalized are prescribed antibiotics because of nosocomial infections, and in these cases, when resistance to antibiotics develops, the doctor's hand is tied and poses a risk to the patient's life. People who have recurrent bacterial infections for various reasons, again, it is emphasized that it is not a viral infection, a bacterial infection at the doctor's discretion. For example, have gum surgery and have to take antibiotics and after a while get a urinary tract infection. If taken correctly, they will not have any problems, because the antibiotic that affects the gingival infection is different from the antibiotic used for the urinary tract infection system. For those who develop recurrent bacterial infections and have to use antibiotics frequently, they will definitely be prescribed medication with a diagnosis of antibiogram drug allergy testing and given an antibiotic that the germ is sensitive to and will kill. In fact, the problem arises when we insist on taking antibiotics when we do not need them, or when we do not take our antibiotic completely when we need to. An antibiotic is a product or substance that is taken from a microorganism and kills or inhibits the activity of other organisms. There are different types of antibiotics that differ in their chemical, physical, and pharmacological properties. There is a group of broad-spectrum antibiotics that work against a wider range of microorganisms, and some antibiotics have a more limited range of effects. Sometimes some viral illnesses get a bacterial infection when they last a long time. Most colds, especially in winter, are viral, and the patient can get rid of the disease with 3 to 5 days of rest and drinking plenty of fluids and does not need to take antibiotics. But sometimes it really is a bacterial disease and it is necessary to take antibiotics. Diagnosis of the type of disease, whether bacterial or viral, is made by examining the discharge from the throat and examining the doctor. Different antibiotics are used differently. Most of them are best eaten after a meal because of the digestive problems they cause, but there are a number of them that should be taken on an empty stomach to be more effective. Some of them also interfere with the consumption of certain foods. The range of antibiotics is very wide and patients should ask their doctor or pharmacist how to use them. Most antibiotics should not be taken with milk, juice, tea, or soft drinks. Concomitant use of milk with some antibiotics reduces their effectiveness. It is better to take them with plenty of water. Antibiotics usually alter the normal flora of the gastrointestinal tract, which is why many people develop gastrointestinal problems, diarrhea, or etc. when taking antibiotics, especially in children. It is natural that when you take a drug, it does not only affect the target cell and the desired microorganism, and it may also affect the rest of the body. Because most vitamins are absorbed through the gastrointestinal tract, it is believed that when taking antibiotics, natural deficiencies or multivitamins can compensate for the deficiency in those who take antibiotics for a long time. Probiotics products are not ineffective either, but the effect of antibiotics is short-lived, meaning that the person takes antibiotics for a limited period. Now this period may be in a special situation, for example 3 weeks. Even in people who have a recurrent infection and are taking medication, there is a mismatch between the natural microbes and the gastrointestinal tract and the antibiotic they are taking. One of the misconceptions is that antibiotics cause heart problems. In this case, you should know that taking them does not affect the heart, and the main problem it causes is microbial resistance.